Hey everyone, it's your family doctor here. Thanks for joining me today. So, let me ask you something. How many of you or people you know are dealing with that constant nagging lower back pain, especially that feeling like something is out of place or pinching? I see this every single day in my practice. You sit at your desk for 8, sometimes 9 hours straight, then you come home, sink into the couch, and scroll through your phone for another couple of hours. That is an enormous amount of pressure on your lower spine. It's no wonder so many of us are struggling with issues like a herniated or bulging disc. Now, I know the moment a lot of people hear herniated disc, they panic, they rush to get an MRI, they sign up for expensive physical therapy, and they end up spending hundreds, sometimes thousands of dollars on insurance copays and deductibles, often without getting the lasting results they were hoping for. So I want to share something with you today that I tell my patients in the exam room. For many of you, doing 3 simple exercises right at home in your own bed can actually be more effective than some of those costly treatments you're paying for. And I mean that sincerely. But before we get into the moves themselves, let's take a step back and really understand what's going on with that disc. Western medicine is fantastic at diagnosing. The MRI shows you exactly where the bulge is pressing on the nerve, and that's crucial information. But we also need to ask the deeper question, why did this happen in the first place? In traditional medical thinking, we look at the lower back as the foundation of your entire body. The health of your lower back is directly connected to your body's core energy reserves. Think of it this way, your lower back is like the foundation of a house. If the foundation is weak and cracked, the whole house starts to shift and settle, and eventually things break. So, why do younger people usually bounce back from these injuries so much faster? It's not just because they're younger, it's because, generally speaking, their core energy reserves are stronger in this model. Your bones and spinal discs are nourished by your body's deep resources. It's like the roots of a tree sending sap and nutrients up to the branches and leaves. When your roots are deep and strong, your spinal discs stay healthy, hydrated, spongy, and flexible. They can handle the daily wear and tear without giving out on you. But what happens to most of us as we get older? And honestly, even when we're young but living hard, we stay up late working or watching Netflix. We run on caffeine and stress. We skip meals. We push through exhaustion. Our schedules are completely out of sync with our natural rhythms. Combine that with sitting all day, which actually weakens that core system, and you've got a recipe for trouble when your foundation is weak. That spinal disc is like a houseplant you forgot to water for 2 weeks, it dries out, loses its bounce and resilience, and the first time you bend over to pick up a grocery bag or lift your toddler, something gives and then the pain hits. Now, here's something a lot of people don't realize. A herniated disc isn't just a mechanical problem like a slipped gear in a machine. If it were purely mechanical, we could just pop it back in and be done with it. But when you're in that kind of pain, it's often a sign that your body's warming energy is running low. Plus, all that sitting and poor eating affects your body's ability to process and move fluids properly. This can lead to what we call dampness clogging up the energy channels in your lower back. Have you ever had a kitchen sink that drains really slowly? It's not that the pipe is broken, it's that there's gunk and grease built up inside, slowing everything down. That's exactly what's happening to your body's energy flow. And when that flow gets blocked, you feel pain. In traditional medicine, we say if it doesn't flow, it hurts, and that's the real source of your back pain. Now, here's the good news. We can absolutely address this. I'm going to show you 3 simple, gentle moves you can do tonight right in your own bedroom. These aren't just random stretches I found on the internet. They are grounded in centuries of clinical observation, and I've seen them work wonders with my own patients over the years. All right, let's get started. Move number 1, the swallow dive. You've probably seen this in a yoga class before. You lie on your stomach, arms resting comfortably at your sides, and then you gently lift your head, your chest, and your legs off the floor at the same time. You're trying to look like a bird in flight, like a swallow gliding through the air. It looks simple, but it's incredibly powerful. This position actively stimulates the energy channel that runs right along your spine. I like to think of this channel as the superhighway for your body's energy. When you arch your back like this, you're turning on the heat, you're waking up that energy flow, you're increasing blood circulation to the area, and you're strengthening all those small but crucial muscles that support your lower spine. In traditional medicine, we say that movement genergy, the more you move, the more you activate your body's natural healing capacity. Now, a lot of you might try this and feel a little more sore the first few times. Doc, why does my back hurt more? I thought this was supposed to help. That's actually a good sign. It means your muscles and tissues are waking up after being sluggish for a long time. It's like pressure washing a dirty driveway. At first, it kicks up a lot of debris and looks messier before it gets clean, but stick with it, that soreness will gradually fade and the relief will take its place. I've had patients tell me that after a week, the movement actually feels good instead of uncomfortable. Move number 2. The bridge, flip over onto your back, bend your knees, keep your feet flat on the bed, and slowly press your hips upward toward the ceiling. You're creating a nice gentle arch, like a little bridge over a stream. This move works the energy channel on the front of your body, which is all about nourishment and support. When you press up into that bridge, you're literally calling on your body's deep reserves to stabilize and support your lower back. And here's why the knees need to be bent. Your knees are the meeting point for all the tendons and ligaments in your body. Think of them as the hubs where all the supporting cables come together. By bending your knees, you're making sure that all those support structures are fully engaged, working together to hold your spine steady and stable. This is crucial because a lot of disc problems happen when those support structures get lazy, weak, and untrained. This move wakes them back up. And here's another benefit here. When you push your hips up, you're directly activating and waking up that core energy we talked about earlier. It's like you're giving your body's engine a jump start. When that energy wakes up, your lower back feels stronger, more grounded, and more stable. Move number 3, the rocking ball still on your back. Bring your knees in toward your chest and hug them tightly. Curl up into a little ball. Just like a turtle pulling into its shell, then just gently rock back and forth on your bed from your tailbone up to your shoulders. This isn't about working up a sweat. It's about giving yourself a gentle, soothing massage. When you rock like this, you're massaging that superhighway energy channel along your spine. You're also working the largest energy channel in your body, the one that runs all the way from the top of your head, down your back, through your lower back, and all the way down to your toes. For people with lower back issues, this channel is almost always clogged up. This gentle rolling motion is like a drain cleaner. It slowly breaks up those blockages and gets things moving again as you keep rocking. You'll notice your body starts to warm up. You might even break a very light sweat. That's fantastic. That warmth is your body pushing out the cold and tension that settled deep in your tissues. Think about it. We spend all summer blasting AC at work and in the car, and then in winter we often go out without enough layers because we want to look stylish. That coldness seeps right into your lower back, causing your muscles and connective tissues to contract, tighten, and restrict blood flow. The rocking motion generates friction and gentle heat, which helps flush that tension out and relax everything. So those are your 3 moves. I recommend doing 10 to 15 repetitions of each one every night right before you go to sleep. Do this consistently for just 2 weeks, and I'm confident you'll notice a significant improvement in your lower back pain. I say that not as a guess, but based on what I've seen in my own practice again and again. Why right before bed? Because at night, your body is naturally winding down. Your energy is moving inward, and a gentle restorative activity like this is perfectly aligned with that rhythm. You're not revving up your nervous system, you're nourishing it. It helps calm your mind, relax your muscles, and prepare your body for deep, healing sleep. It's really a win-win. Now, I do have to give you a few important safety notes before you start. If you're in an acute, severe flare-up, the kind where you can barely roll over in bed and the pain is so sharp you can't even stand up straight, please don't do these exercises at that point. The best thing you can do is rest. Take a few days to let the acute inflammation settle down. Once the sharp, severe pain subsides and you can move a little more freely, then you can slowly, gently start these exercises. Also, if you have a significant heart condition or uncontrolled high blood pressure, take it extra slow, move gently, breathe steadily, and don't hold your breath or strain. Always listen to your body. Now, beyond these 3 exercises, we need to talk about your everyday habits because honestly, you can't out-exercise a lifestyle that's working against you. I see this all the time. Patients do their exercises faithfully, but they don't change the other things, and then they wonder why they're still hurting. So let's cover the big ones. First, keep your lower back warm. I cannot emphasize this enough. Your lower back does not like cold, it doesn't like drafty rooms, it doesn't like air conditioning blowing directly on it, and it certainly doesn't like being exposed to cold winter air. When your lower back gets cold, your muscles and tissues tighten up, blood flow decreases, and your risk of injury and pain goes way up. Wear a higher waisted underwear or a camisole that tucks in. Use a warm water bottle or a heating pad on cooler evenings. Put a warm pack on your lower back while you're watching television. This simple habit alone can make a dramatic difference. Second, let's talk about your diet. What you eat either helps or hurts your recovery. If you're eating a lot of raw salads, drinking iced beverages, eating ice cream, or grabbing cold smoothies, you are literally cooling your system down from the inside out. That's the opposite of what we want for healing. Instead, try to eat more warming, cooked foods, think soups, stews, and broths. Incorporate warming spices like ginger, cinnamon, and turmeric. Ginger is fantastic. You can steep fresh ginger in hot water with a little brown sugar for a comforting, warming tea. Lamb is also excellent if you eat meat. It's a naturally warming protein. These small dietary shifts can really support your body's healing process. Third, sleep. This is a non-negotiable. We've gotten into this terrible habit of treating sleep like it's optional or something we'll catch up on later. But staying up late night after night is like leaving your phone on high drain mode with the charger unplugged. Eventually the battery dies, your core energy gets depleted, your body doesn't have the resources it needs to repair tissues, and your lower back, which relies heavily on that energy for support, starts to feel weak, achy, and unstable. I always tell my patients the best supplement I can prescribe is an early bedtime. Try to be in bed by 10:30 p.m. and wake up naturally with the morning light around 6 a.m. That rhythm is deeply aligned with your body's natural cycles and it supports optimal healing and repair. Fourth, stress and emotional health. This is a huge underappreciated factor. There's a reason why traditional medicine links the emotion of fear and chronic worry to the health of the lower back. When you're constantly stressed out, worried about your job, your mortgage, your kids, the news cycle, it takes a direct, measurable toll on that core system. Your nervous system stays in a low-level fight or flight state, your muscles stay tense, and your body diverts resources away from healing and repair. You have to find ways to unplug, take a walk in the park, listen to birds, sit quietly for 5 minutes without your phone. Or pick up a hobby you enjoy. It's not indulgent. It's essential for your health. When your mind calms down, your body follows. Fifth, be mindful of your intimate life. I know this can be an awkward topic, but it's important to talk about. Your body's deep reserves are also involved in your reproductive health. Overdoing it without giving your body enough time to recover can drain those reserves, leaving you more vulnerable to back problems. It's about balance, not deprivation, but conscious moderation, especially during times when you're already in pain or recovering. Now, some of you might be thinking, okay, but does this mean I can never exercise again? Am I just supposed to lie around forever? No, absolutely not. That's actually the opposite of what you should do. I know a lot of people, when they have back pain, are terrified to move. They think if they just stay completely still, the problem will go away, but the opposite is true. Your body is like a stream. Water that flows stays clean and fresh. Water that stagnates gets murky and full of algae. The same principle applies to your body. If you don't move, your circulation gets sluggish, your muscles get weaker, and the problem actually gets worse over time. And this is but you have to choose the right kind of movement. High impact activities like running, basketball, or heavy weightlifting are going to put too much jarring force on your spine, and I don't recommend those for most people with disc issues. But gentle, flowing activities, absolutely. Swimming is phenomenal because the water supports your body weight, reducing pressure on your discs, while the resistance of the water gently strengthens your muscles. Tai Chi is excellent. It's slow, deliberate, and deeply restorative. Walking is great as long as you're wearing supportive shoes and keeping good posture. The key is to keep moving, but move wisely. Now, I also need to say something about the endless parade of so-called miracle cures out there. I know you've seen the ads, the special pillows, the back braces, the pain relief patches, the supplements, the gadgets. They all promise to fix your back in 7 days or your money back. I'm going to be honest with you, most of these are just clever marketing. The truth is, there's no one-size-fits-all pill patch or gadget that works for everyone. Different people have different root patterns. Some people's problem is mostly depletion, they're exhausted, their reserves are empty. Some people have poor blood circulation and their tissues aren't getting the oxygen and nutrients they need. Some people have that dampness and stagnation we talked about earlier. Each of these requires a completely different approach. You wouldn't give the same antibiotic to someone with a viral infection and someone with a bacterial infection. They're fundamentally different problems. The same goes for back pain. So when you see a product that claims to cure everyone, just smile, nod, and keep walking. This brings me to a common question I get all the time. Do I need surgery for this herniated disc? This is a huge concern for so many people, and I understand why you're in pain. You see the MRI, and the doctor shows you the image of the disc pressing on the nerve, and it looks scary, but let's be clear about something. Surgery is an amazing tool for emergencies. For example, if you have sudden loss of bowel or bladder control or progressive weakness in your legs, that's getting worse fast. In those cases, surgery is absolutely indicated and can be life-saving. But for the vast majority of people with a herniated disc, surgery is not the first choice, and it's not the only choice. Here's the thing about surgery, it removes the bulging piece of the disc. It takes pressure off the nerve, and that gives you immediate symptom relief. That's wonderful, but it doesn't address why the disc herniated in the first place. Why did that disc dry out and lose its resilience? Why did those support structures get weak? If you don't answer those questions, if you don't change the underlying conditions that cause the problem, then even after surgery, the same forces are still at work. You could easily develop another herniation at a different level a few years down the road. And then you're looking at another surgery. Plus, any surgery carries risks, infection, bleeding, anesthesia complications, and the very real risk of accidentally damaging a nerve. These risks are not trivial. So my philosophy, and the philosophy I share with my patients, is this: do everything you can conservatively first. Give your body the chance to heal itself. Most of the time it will, if you give it the right tools and support. The 3 exercises I've shared with you today are exactly that. Tools to help your body heal itself. They address the root issues, improving circulation, strengthening support structures, clearing out stagnation, and warming up the area. They're not just treating the symptom, they're treating the whole person. That's why they work so much better than quick fixes. Now, I know some of you might have tried physical therapy before and found it didn't help, or it only helped temporarily. And I understand that frustration often when physical therapy doesn't work, it's because the therapy is treating the local symptom, stretching the muscle, loosening the joint, but it's not addressing the deeper systemic imbalances. You might feel better for a few hours after your session, but then you go home, sit in the same chair, eat the same food, stay up late, and within a day or two, you're right back where you started. That's not because physical therapy is bad. It's often very helpful, but it's only one piece of the puzzle. What I'm giving you today is a more complete approach. You're not just doing isolated stretches. You're working on your energy, your circulation, your support systems, and your lifestyle all at once. And here's the beautiful thing: when you do this consistently, the benefits go far beyond your back. I've had patients come back to me after a few weeks and tell me, you know what, my back doesn't hurt anymore. But I also noticed I'm sleeping like a baby. I have more energy during the day, and I'm not so stressed out anymore. That doesn't surprise me. When you strengthen your core foundation, everything else improves. Your bones get stronger, your brain gets more nourishment, your mood stabilizes, and you feel more vibrant and alive. It's not magic, it's just good physiology. Some patients have even told me that their waistline looks slimmer after doing these exercises for a while, and honestly, that makes total sense when your digestive system starts working better because you're moving, eating better, and sleeping better. Your body stops holding on to excess water and bloating. The dampness we talked about starts to clear, and suddenly your belly looks flatter and your clothes fit better. That's not a weight loss gimmick. That's your body returning to a healthier, more balanced state. Now, I know some of you might be a bit older, maybe in your 60s, 70s, or even 80s, and you might be thinking, but I'm not as flexible as I used to be. My bones aren't as strong. Can I really do these? Yes, you absolutely can. And I mean that there's a saying that goes, if your vital energy is strong inside, outside pathogens cannot invade. The issue is rarely your age. It's about whether your body has enough vital energy to support itself. I've seen 80-year-old patients who are more agile and have fewer back problems than 30-year-old patients who sit at a desk all day and don't take care of themselves. It's not about the number of candles on your birthday cake. It's about how well you've been caring for your body over the years. For older adults, the key is to start slowly. Don't try to lift your chest and legs as high as you can on day 1. Start small, do just 5 repetitions instead of 15. Move slowly and gently, never forcing anything. Listen to your body. It will tell you what's comfortable and what's not. Over time, as your body gets stronger, you can gradually increase the number of repetitions and the range of motion, but don't rush. Healing is a marathon, not a sprint, and that brings me to the most important word in this entire video, consistency. I cannot tell you how many people do these exercises for 2 or 3 days, and then when they don't feel a dramatic improvement, they give up. That is such a tragedy because they were just about to turn a corner. Your body didn't develop this problem overnight, and it's not going to fix itself overnight either. Healing takes time, it takes patience, it takes trust in the process. Generally speaking, if your symptoms are mild, you might start feeling better within about a week. If your symptoms are moderate, give it 2 to 3 weeks. If your symptoms are more severe or long-standing, it could take a month or two of consistent effort, but I promise you, if you stick with it, your body will respond. It's designed to heal. You just have to give it the right conditions. And here's another great thing about these exercises. They're not just for herniated discs. They are also incredibly helpful for other lower back conditions like muscle strains, a condition where one vertebra slips forward over another, or spinal stenosis, which is a narrowing of the spaces within your spine. All of these conditions share a common underlying theme. They involve some combination of weak support structures, poor circulation, and stagnation. So these three exercises address that common root, which is why they're so broadly effective. Now think about this for a moment. If you go to a hospital or a specialist for a herniated disc, you're looking at hundreds or even thousands of dollars in bills, imaging costs, specialist copays, physical therapy sessions, possibly surgery if it comes to that. And even after all that, there's no guarantee you'll be pain-free. But this approach I'm sharing with you today, it costs you nothing. You don't need a gym membership. You don't need special equipment. And you can do it right in the comfort of your own bed. And in my clinical experience, it's often more effective than many expensive treatments. That's not just a great value, it's peace of mind. Now, I want to be very clear about something. I am not telling you to never see a doctor or to refuse medical care. That would be irresponsible. And I would never do that. If you have severe symptoms, if you're losing control of your bowel or bladder, if you have significant weakness in your legs, if you have numbness that's spreading, or if your pain is simply unbearable despite conservative care, please go see your doctor, get the appropriate imaging. Follow your doctor's advice. There is absolutely a time and place for medical intervention. What I am saying is this: for the vast majority of people with lower back pain from a disc issue, there is so much you can do yourself at home that will make a profound difference. And more than that, the process of taking charge of your own health is deeply empowering. You start to really understand your own body. What helps it, what hurts it, what makes it feel strong, what makes it feel sluggish. That understanding is something no doctor can give you. It's something you have to develop for yourself. And once you have it, it stays with you for life. That's far more valuable than any pill or surgery. I think a lot of people today feel very disconnected from their bodies. They have a headache. They take a pill, they have back pain, they go to a specialist, they have trouble sleeping, they take a supplement, and while those things can be helpful, they often treat the problem without really helping you understand where it came from. The root issue isn't addressed, and so the problem keeps coming back. What I'm offering you today is a different path. It's a path of self-awareness and self-care. It's a path where you are an active participant in your own healing, not just a passive recipient of treatments. That's why I love sharing these exercises. They're simple, they're safe, and they put the power back in your hands. I've seen too many patients in my office who are young, sometimes in their 20s or 30s, whose quality of life has been wrecked by lower back pain. They can't play with their kids, they can't enjoy their hobbies, they're irritable and tired all the time, and their relationships suffer because they're always in discomfort. It's honestly heartbreaking. And the vast majority of it could have been prevented if they had just learned some simple maintenance habits earlier. They didn't need expensive treatments. They just needed a little knowledge and a little consistency. So I really hope you don't just watch this and then forget about it. I hope you take this information and actually apply it. Start tonight. Do these 3 exercises before you go to bed. Give yourself 2 weeks of consistent practice. Mark it on your calendar and then check in with yourself. How does your back feel? How's your sleep? How's your energy? I am genuinely confident you will notice a difference, not just in your back, but in your whole overall well-being. Remember, your health is in your hands. It really is. Doctors like me are here to give you information, to offer you options. But at the end of the day, the daily choices, what you eat, how you sleep, whether you move your body, how you manage your stress, those are all up to you. And those choices make a bigger difference than any prescription I could write. The medical wisdom I've shared with you today has been passed down and refined over centuries. It's not new. It's not flashy and it doesn't come in a shiny box with a money back guarantee, but it works. It works because it's based on a deep understanding of how the human body functions as a whole. All you have to do is trust it, commit to it, and practice it. If you stick with these exercises, if you make the lifestyle adjustments we talked about, I truly believe you will see a significant improvement in your lower back pain. You'll also feel more energetic, more resilient, and more in control of your health. And that's a wonderful feeling. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science. Not replace professional medical advice. Take care of yourselves, be kind to your bodies, and I'll see you in the next one.